Hi, good morning. Hi, good morning. This is Ali. Today we are going to discuss the health or care. Here in this chapter. The WHO assesses the World Health System. It's a very good organization. WHO has carried out the first ever analysis of the World Health System using five performances indicators to measure health system in 191 member states. It finds that France provides the best overall healthcare, followed among major countries by Italy, Spain, Oman, Austria, and Japan, and America. The finding that are the very good in the as per report of the WHO. The US health system spends a higher portion of its gross domestic production than any other country, but ranked 37 out of 191 countries. According to its performance, the report finds the United Kingdom, which spends just 6% of GDP on health services, ranked 18th. Several small countries, San Marino, Andorra, Malta, and Singapore are rated close behind. Second place, Italy, and here is the World Health Report says the main failing of many health systems are many health ministers focus on the public sector and often disregarded the frequently much larger private sector healthcare in many countries. Some, if not most, physicians work simultaneously for the public sector and in private practice. This means the public sector ends up organizations unofficial private practice. Many government falls prevent a black market in health where the widespread corruption, verbally in moonlighting and other illegal practice, flourishing black market, which themselves are cast the malfunctioning health system and low income of the health worker further undermine those systems. Many health ministers fail to enforce regulations that they themselves have created or are supposed to implement in the public interest. While private health expense is in the industrial countries now coverage only some 25% because of the universal healthcare coverage expect in the United States where it is up 56%. In India, families typically pay 80% of their healthcare cost as out-of-pocket expense when they receive health care. In the other countries where I have created a new tool to help us measure performance, says Dr. Mary, as we develop in further and strengthen to draw raw data used for those measures in years to come. We believe this will and increasingly useful tools to for governments improving their own health system. Very good. In the Brazil, now we are going to discuss in Brazil a middle income nation ranks low in this table because these people make high out-of-pocket system payment for healthcare. This means a substantial number of the households pay a large fraction of their income after paying a food, Healthcare, same example, explanation applies to the fairness of the financing payroll healthcare system. The reason why Russian Federation ranks low is most likely related to impact of the economic crisis in 1990s. This has a severely reduced government spending on health and led to increased out-of-pocket payment. In North America and Canada, rates are country with the fairest and mechanism for the health system finance ranked at 1790, while the United States is at 54 to 55. Cuba is the highest among Latin American and Caribbean nations at 23 to 25%. Or is the distribution of health in the population. It is not sufficient to protect or improve the average health of the population. If at the at the same time, inequality worsen for remains highest because again occurs this proportionality to those already enjoying better health. The health systems are also has been responsibility to try to reduce inequality by prioritizing actions to improve the health worse off. Thank you so much. Today we are going to end our session and we'll wait for our next continue session video. Thank you so much. Have a good day. Please stay safe. Have a good day. Bye bye.